As you all know, healthcare has data problems within the pipelines and within the operational organizations dealing with data today. Data capture at the point of care is disparate. There's a lot of different source systems creating content in a lot of different ways, be that a patient intake operation or a laboratory information system or an EMR itself. And as that data is being captured, a lot of times it gets sent downstream through the pipes in a lot of disparate ways. Vendors might be sending data only to adhere to the minimum accepted requirements of transmission information. And as it gets into the aggregate layer, it permeates a problem in data that puts it on the shoulders of data aggregators and data stewards to plug the holes. And as organizations are trying to plug the holes, it could lead to critical gaps and inconsistencies. And this is wholeheartedly present within the structured side as well as the unstructured side of the equation. And if you're an organization that wants to do data quality insights, or you want to cohort query on your patient populations for any bespoke use case, if you have bad data in, then you're wholeheartedly going to have bad data out. And one of the key fabric points of data provenance in this whole ecosystem is complex web of terminology and terminology standardization. If you're not doing it correctly, these challenges are always going to be permeating throughout your whole ecosystem. And IMO did a recent research survey to a lot of our participants across all of our contract entities. And we asked the question, how many of you believe that data issues are a major threat within your organization? And 45% of them said yes, it is a major threat, quantifying it majorly. And the second operation insights in here is like, well, quantify that risk to us. Are you losing money? And 90% admitted to saying yes. I'm losing revenue either by FTE operations or because of revenue loss of queries into measurement operations or into just rev cycle operations themselves. And this is a problem that we all know to be present within the industry.